My name is Dr. Chinwe Lucia Ochu. I'm the Director of Prevention Programs and Knowledge Management at the Nigeria Center for Disease Control. What NCDC is about. The Nigeria Center for Disease Control was established in 2011 as an autonomous entity. The center was established with a mandate to detect, investigate, prevent, and control diseases of national and international public health importance. The role of NCDC is to also strengthen human capacity and institutional linkages, promote zonal and state preparedness, promote multi-sectoral planning and coordination in public health services and pandemic preparedness and response, and prepare the nation for the prevention of intentional or non-intentional release of harmful biologic products. The NCDC bill. The establishment of NCDC has received presidential and the Federal Executive Council's support, as well as endorsement by the National Council of Health. The NCDC Act 2018 provides the legal backing for the organization to coordinate public health surveillance, laboratory and response functions for all infectious diseases, and to also build trust among Nigerians through regular communication, prevention programs, and knowledge management. The Directorate of Prevention Programs and Knowledge Management develops health promotion and disease prevention plans, which address priority endemic infectious diseases and non-communicable diseases. The Directorate conducts research to inform evidence-based policies and practice, and also make evidence-based practice the foundation of all programs at NCDC. The team also works with other government agencies and partners to promote partnerships and collaborations, especially towards strengthening the One Health approach. What is antimicrobial resistance? Antimicrobial resistance, also known as AMR for short, is the resistance of bacterial, viral, parasitic, and fungal microorganisms to antimicrobial medicines that were previously effective for their treatment. AMR occurs naturally over time, but can be facilitated by inappropriate medicine use, poor adherence to infection prevention and control standard precaution measures, limited surveillance, and also poor access to diagnostics, as well as diminishing arsenal of antibiotics all around the globe. Why is antimicrobial resistance important? In over 68 years, we had only 14 new classes of antibiotics discovered. Meanwhile, for over 10 years, human consumption of antibiotics increased by 30%, while use of antibiotics in animals also increased by about 50%. The emergence and re-emergence of antimicrobial resistance is accelerated by inappropriate and indiscriminate use of antimicrobials. So not controlling AMR has led to and may continue to lead to loss of lives from resistant infectious disease pathogens. NCDC in AMR Response. NCDC is Nigeria's National Public Health Institute responsible for the implementation of AMR surveillance and response in Nigeria. It is also the National Surveillance Coordinating Body whose role is to connect with other relevant stakeholders to implement the AMR National Action Plan. In 2016, AMR Coordinating Body was established at NCDC, where Nigeria signed the United Nations Declaration to develop an AMR National Action Plan. In April 2017, the Directorate coordinated the development of a National Antimicrobial Resistance Situational Analysis and Action Plan, as well as the enrollment of laboratories into the Global Antimicrobial Resistance Surveillance System, known as GLASS. Categories of stakeholders collaborating with the NCDC under the One Health approach to AMR response and antimicrobial consumption and use campaign in Nigeria include the Federal Ministries of Health, Agriculture, Environment, the National Agency for Food and Drug Administration and Control, NIPRID, NIMA, National Institute for Medical Research, regulatory bodies, pharmaceutical manufacturers groups, companies, the academia, health professional regulatory agencies, private sector, and the teaching hospitals. AMS in combating antimicrobial resistance. Antimicrobial stewardship is a coherent set of actions that promotes using antimicrobials in ways that ensure sustainable access to effective therapy for all who need them. It improves access to quality antimicrobial agents for infections in humans and animals. It promotes antimicrobial stewardship in humans and animals, and strengthens regulatory agencies across all sectors, humans, animals, and environment, to enforce rational antibiotic use. So what should healthcare workers do? We are calling upon healthcare workers to ensure that microbiology guides antibiotics and antimicrobial therapy at all times. They should also ensure that indications for therapy are evidence-based and that the narrowest spectrum of antibiotics are prescribed. Dosages should be administered through appropriate routes and targeted at a specific infection. There is need to minimize duration of therapy and to use monotherapy, that is single therapy of antimicrobials, as much as possible. So this is why it is important that we are rolling out these training modules for access to healthcare workers to enlighten them on how to ensure antimicrobial stewardship even as they work to deliver their healthcare services to Nigerians.